It's vital if we're going to achieve success as a clinical commissioning group to bring our population with us and have the conversation with the public about what the public's role is going to be in the future in looking after themselves and what they are going to do for their NHS as much as what the NHS is going to do for them. And that's quite a different change and a different dynamic in the relationship between the NHS and the public and patients.
None of the decisions taken by the CCG will be taken without first asking local people what they want. So all of that feedback does get to the governing body. They consider it in their decisions, and then we feed back to the local people what we've done as a result.
I think on the one hand we've got to have patients involved in shaping services in Stockport and nationally, but also I think it's really important that we as GPs we see the patients that come and see us, but it's very easy to forget the patients that don't come. And I think it's something about trying to engage that population, to take ownership, to come in and be screened, to get their blood pressure checked, to seek, perhaps when they're well, the services that will help them stay well.
The idea behind the pilot was to explore patient and public involvement within general practice and look at how the emerging CCGs could be supported in developing that and embedding that into their day-to-day work.
I think we have made it difficult because we haven't gone out into the communities and targeted various different patients. We've always gone to the same groups. We've always had the opinions of the same types of patients. So it's really important that we get a variety. Such as our engagement, where we went out to groups for the parent engagement groups. We went to the ethnic diversity service. We went to the supporting housing groups. So we had a variety of service users and patients that we targeted.
I think that people who are service users do want to be involved in services, for most of them, but that's not everybody by any means. We need the whole public engagement. If we are to do something about really improving health in this country, it's about prevention, and that's the whole of the public. And that's why we have got to work together on all aspects of prevention, rather than simply waiting till citizens become patients and with conditions that need treatment.
But we have about 5,000 patients at the practice, and of those we probably regularly see about 1,500, which leaves a big population who may come generally when they're unwell. And so yeah, it's something about trying to reach that population and make sure they have equity of access really into services that they perhaps don't know exist.
The more useful sort of road in really was to start working with the practice managers. And that was the initial idea, to start working with practice managers across a number of selected practices in Stockport to explore what work they'd previously done with patient engagement, where they were at in terms of its priority, and also to explore perhaps with other practices that hadn't done much work at all with patients, how they could perhaps really make a start.
Practice managers will always be at the heart of the engagement group, and I think their role will be to drive that and to lead it forward. But I do feel that everybody in general practice has a part to play in the patient engagement, from a receptionist right through to a GP, and possibly even beyond that with the clinical commissioning groups and and other local services.
Papers and proposals that go to the meeting, they first have to be checked to see have they had any patient engagement on them. At the start of a paper you'll give some information, so there's all the data about health. There should also be a section in there that says who've we spoken to and what are their views. So none of the decisions taken by the CCG will be taken without first asking local people what they want.
No, it's not just the job of practice managers, it's the job of the whole community, from the hospital to the health PCTs or CCGs as they will be known, right down to the grassroots. It's everybody's responsibility to look after their community and their health.
We're doing a piece of work at the moment on prescribing, with the aim of reducing medication waste and encouraging people to take their medication properly. So rather than just doing a big bang campaign and talking about how much money is wasted in the NHS, which is usually the focus of these campaigns, we've got some members of the public coming in to talk about what might be the best messages to encourage people.
One of the early examples is that we've gone out to look at how we integrate our community sexual health service with the GUM service, and we've gone to young people within a local college and asked them, is it a good idea to have services available on one site so that you can get all the service that you need for that particular issue delivered at one appointment. And we've had very positive feedback from that event so far, and that's being fed into how we shape that service.
It's very important to get the views of patients because we wanted to find out how they were using the out-of-hours service and what they felt good about it. Whether the location was convenient for them and also if they found the service easy to access. We started by drawing up a patient questionnaire and we uploaded that onto the Citizen Space website. But to get further engagement from patients, we decided to ring up various practices in Stockport and ask them if we could go and sit in their waiting rooms and encourage patients to take part in the questionnaire. So we did that by taking the iPads out and we got patients involved in that way.
The hospital is now responsible for delivering services in the community as well. So as we start to move along that path and integrating services, we want to engage with users to find out how they want the services delivered to inform our service development.
It's very easy to ask questions, but if you don't see the outcome and the comments come to fruition, then why bother? So I think, you know, that we've made, certainly for Stockport and certainly within our practice and as part of the national scheme to try and improve patient engagement, there's a feedback mechanism through the website and through email again that gives that feedback to patients. I think it's really important because otherwise I think people will lose interest.
One of the big comments we've had a lot from people is in the past is that we go out and engage with them and then it's radio silence, they hear nothing, so they don't know if we've used it or not. A key function of this website is that after you've got the results, you publish them online. We also send them out to people and we go back to people and we said, based on what you said, this is what we've done as a result.
I think it's very encouraging for people to find that their involvement has had some impact and has had a positive benefit to other people.
So one of the things that I wanted to do within the pilot was not just sort of say, stick up a poster in the waiting room, ask patients to come to a Wednesday afternoon, cup of tea and a biscuit and call it a patient group. We wanted to do something a little bit different, and that was a challenge for the pilot. So, for example, I worked with some practices around patients with specific conditions who might be interested in joining a patient group that also had that theme in common. So, for example, diabetic patients might be interested in getting together within the practice and looking at how, through patient groups, more support could be provided to patients and help them to manage their condition better. Positive spin-off obviously for the practice as well, and also it starts that dialogue around patient groups.
It's important that we as a acute provider work with the CCG and the PCT, because at the end of the day the users of services and the general public do not see those different organisations, they see the NHS.
What we think we might do for the next year, for year 2 of the patient group DES, is to keep the virtual group going as it is, but maybe either invite or select patients, perhaps a smaller group within that we meet with on a face-to-face basis, who can perhaps then take over some of the running of that group as well. We hope that perhaps if our patients see other patients becoming more involved, it might actually encourage them to become even more involved themselves and maybe even create a bigger group.
My view of public service is it should be about serving the public in an integrated way. My own background was in local government, and what we've done in Stockport is try to integrate a lot of our working with the council and indeed with the Foundation Trust, because I think the public doesn't always see or want to see the distinction. We should actually look at people as whole people, not as recipients of different services.
We need to engage with the public before they become patients in changing their lifestyles, looking after themselves, eating more healthily, not smoking, not drinking to excess, using best sexual health practices, all these health promotion ideas that have been around for years, really haven't got traction with the public till now. But unless we achieve that now, then the NHS is going to be at risk for us all. So it becomes everyone's duty to look after themselves and have the NHS help them look after themselves. And that's the relationship we want with the public.